The term referred pain describes a type of pain that is experienced in a region of the body that does not contain the source of the pain. This type of pain is typically associated with the body's internal organs. For example, you are probably aware that a person having a heart attack will often experience pain in their left arm and jaw. The source of the pain is actually the distressed heart muscle, but the pain is not experienced deep in their chest, but rather in the left arm and jaw. Hence, this cardiac pain is termed referred pain because it is projected to the left arm and jaw. In fact, all of the body's major organs refer pain to some adjacent region of the body, not just the heart. The mystery of trigger point referred pain results from healthcare practitioners failing to recognize that skeletal muscle is an internal organ, the body's largest organ, in fact, and is therefore capable of producing referred pain. The projection of trigger point referred pain can make it difficult for clients and their healthcare professional to locate the source of their musculoskeletal pain. And this inability to pinpoint the source of the pain often makes treatment a hit or miss proposition. An analysis of the trigger point referred pain distribution shows that 56% of trigger points refer pain to both local and distant regions. 24% of trigger points refer pain only to the local region, and 20% of trigger points refer pain only to the distant regions. As an example of the referred pain phenomenon, let's examine the typical neck ache. Common sense suggests that if the neck region is painful, then the problem lies within the neck. A physician might examine the bones, the joints, nerves, and muscles of the neck in an attempt to identify the source of the neck pain. But the most likely cause of neck pain, statistically speaking, is trigger point activity in the lower trapezius muscle. Thus, the actual source of the neck pain is found not in the neck, but between the shoulder blades. This all seems rather counterintuitive, unless you ask the question, what purpose does this pain referral serve? The purpose of referred pain, like all pain, is to protect the injured tissue. In this case, the specific goal of this referred pain is to limit the use of the trapezius muscle so that it can heal. As the trapezius muscle functions to move the neck and the head, its pain is referred to these structures to discourage movement of them. As a result, people experiencing neck pain and headaches naturally want to lie down and immobilize their head, and this allows the trapezius muscle to rest and recover from its overload. But trigger points don't just refer pain. They also refer motor distortions to other muscles. These motor distortions cause some muscles to become neurologically inhibited or weak, and other muscles to become tense or prone to hyperactivity and spasm. These patterns of motor distortion serve the same purpose of referred pain, to encourage rest and recovery of the muscle harboring the trigger point. In summary, a therapist's understanding of trigger point referred pain patterns is fundamental to their ability to identify the source of a client's musculoskeletal pain and to address it effectively. Besides referred pain, trigger points are capable of producing other symptoms that are not typically associated with the muscular system. These symptoms are generated by referred motor and sensory distortions imposed on the autonomic nervous system by trigger point activity. Some examples of other symptoms include numbness and tingling, visual disturbances, balance problems and dizziness, excessive eye tearing, sore throat, sinus discharge, abdominal bloating, heartburn, and vomiting, and gynecological disorders such as dysmenorrhea.